Hi, I'm going to be speaking to you today about preparing for your bariatric surgery at Monmouth Medical Center. Important reminders: please have your favorite protein shakes, sugar-free ice pops, low-sodium broths already purchased prior to surgery. Please remember, we do not recommend the use of straws, no carbonated beverages such as soda, and no caffeinated products. In addition, it is very important that you stop smoking prior to surgery at least 4 weeks. This does include vaping. You will be tested for nicotine prior to surgery, and positive results will cancel your surgery. Also, remember to switch out your non-steroidal anti-inflammatory medications such as ibuprofen, Aleve, naproxen, and Motrin, as these can cause ulcers and bleeding. We recommend using Tylenol products after surgery. There is a Tylenol product for any ailment. You can take either a pill form or liquid form. If you need something stronger, please call our office. Now is also a good time to think about your post-surgery medications. See if they're really big pills. Do they need to be crushed or opened or cut in half right after surgery? Please discuss this with your surgeon. Long-acting medications typically cannot be crushed or opened, so you would want to consult your local pharmacist if you're not sure. We do recommend after surgery that you take one pill at a time with a small sip of water and wait 15 minutes before taking the next. If you have any questions in regard to that, please ask your surgeon. What to bring and what not to bring to the hospital. We recommend bringing comfortable clothing and a favorite pillow for hugging as you get out of bed. If you were prescribed a CPAP, please bring that along with your insurance, ID, some chapstick, your phone, and a charger. Please leave your valuables and expensive jewelry at home. To avoid potential complications after surgery, we will be giving you blood thinners at the time of surgery, providing you with compression boots on the bottom half of your legs, and encouraging early ambulation after surgery. To prevent infection, we will give you antibiotics. We do recommend frequent hand washing and not picking at the incisions on your abdomen. To prevent respiratory complications, we will be providing you with an incentive spirometer, which will encourage you to cough and deep breathe, and walking can also help. Before surgery, please note if you are on blood thinners or antiplatelets such as aspirin, Coumadin, please check with your prescribing physician and bariatric surgeon as to when you should stop taking these medications before surgery. Please let your surgeon know if you are on birth control as well. Do not miss your pre-admission testing appointment. If you do postpone it or not show up, it can result in rescheduling of your surgery. Preparing for an early recovery. We have implemented protocols to help you recover faster and get home as quickly as possible. That will be reviewed in the following slides. Preparing for an early recovery. During your pre-admission testing appointment, you'll be given chlorohexidine wipes and instructions that you will follow to use the wipes the evening before surgery and the morning of surgery. This helps prevent any surgical site infections. The nurse will review your medications and tell you what to take the morning of surgery. Typically, the evening before surgery, you will take any of your prescribed medications. In addition, we do ask that you take 2 extra strength Tylenol before going to bed. During your pre-admission testing appointment, you will be given 1 bottle of Ensure pre-surgery drink. It's a drink that provides complex carbs and helps provide energy, promotes hydration, and can help you feel better after surgery. If you are diabetic, you will drink this entire bottle the evening before surgery at bedtime. Please try to drink the entire bottle in 15 minutes or less. If you are not a diabetic, please drink 1 bottle the morning of surgery as soon as you wake up, or at least 1 hour before you leave your home to come to the hospital. Again, please drink the entire bottle in 15 minutes or less. The big day. What can you expect? It typically is a 1-night stay in the hospital. We ask that you arrive 2 hours prior to your surgery time, park in parking garage, and enter through the left of the garage elevator. Go to the information desk. Report to Kramer Surgery Center to be registered and checked in. Then report to the surgical unit on the 4th floor. The morning of surgery. Non-diabetics, once again, Drink the Ensure pre-surgery drink when you wake up or 1 hour before you leave to come to the hospital. Try to drink that entire bottle in under 15 minutes. Complete the chlorhexidine wash to your abdomen before leaving for the hospital. When you're in the hospital, to ensure your safety, you may be asked to state your name and date of birth several times. Please make sure you have your driver's license or some form of identification with you. Your surgeon and anesthesiologist will visit you prior to surgery to discuss the procedure and answer any questions. On the day of surgery, you will recover in the post-anesthesia care unit, also known as the PACU. You may be given a sugar-free lozenge to help wake up your gut. After surgery and after recovery, you will be sent to G6, which is our designated bariatric unit. Family may visit once you are in your room. Please remember to cough and deep breathe. This is so important for your recovery. And walk. Use the call bell to notify your nurse when you're ready to move. Please note, due to receiving anesthesia and pain medication, you are considered at high risk for falls, and you should call the nurse for assistance before getting out of bed the first time. Many people will be involved in your care, such as medical students, surgery residents, a dedicated surgery nurse practitioner, and the nurses and staff of G6. On the day of surgery, we do hope that your pain is minimal, but we will monitor you by the nursing staff and your surgeon. During surgery, your surgeon does use a local anesthetic to create a numbing effect on your abdomen. We do implement non-narcotic forms of pain management to help minimize the amount of opioids you receive while in the hospital. By using less opioids, your body will return to normal function faster, and you should feel better sooner. Do not wait, though, until your pain is unbearable. Let your nurse know when you are uncomfortable, and you will be medicated based on what your surgeon has ordered. Some equipment to expect: heart monitors, incentive spirometer, compression boots, medicine cups, bed alarm, and IV fluids. On the day of surgery, when beginning your liquids, we recommend that you start out slow, small sips, 1 to 2 ounces an hour. Drink slowly and use those medicine cups. Gradually increase fluids to 3 to 4 ounces an hour. By the time you leave the hospital, you should be able to tolerate up to 4 ounces per hour, which means about 1 ounce every 15 minutes. Continue to drink 4 ounces per hour from the time you wake up until the time you go to bed. Surgery aftercare, we will provide you with this worksheet to help monitor your progress and provide important reminders of what is expected of you during your hospital stay. Aftercare goals should be frequent walks, deep breathing exercising using the incentive spirometer, and tolerating your clear liquids. Please use that incentive spirometer at least 10 times an hour and use your checklist. Sip fluids, 1 ounce every 15 minutes while you're awake, and get up and move. Walking will help with the gas pains as well. On the afternoon of post-op day 1 is typically the day that you go home. Your goals at home should be the same. Continue frequent walks and deep breathing exercises. Drink your protein drinks. It's very important for healing. No lifting over 10 pounds and no abdominal exercises until your surgeon clears you to do so. You can drive when you're no longer taking narcotic medication for at least 24 to 48 hours and can move freely in the car. We do ask that you have someone drive you home from the hospital. Any issues at home, when to call your surgeon. Any fevers over 101.5, redness, warmth, foul-smelling drainage from any of the incision sites, difficulty breathing, a worsening of pain or a change in the pain, any dizziness or confusion, please call 911. If you've had no bowel movement for at least 5 or 6 days after surgery, and you cannot keep any fluids down and you're constantly vomiting. After hours, weekends, and holidays, if you have questions or immediate concerns, we ask that you call the doctor's services directly. For Drs. Binnenbaum, Barreo, and Dr. Matheru, 732-389-1331. For Dr. Jurancic, 732-901-8604. And Dr. Olinikoff, 862-781-3556. Do not forget, the evening before surgery, please take your 2 extra-strength Tylenol before bed and any of your prescribed medications. Complete the chlorhexidine wipes per instructions. Remember to keep drinking and walking, and then after surgery to follow up with your primary care or any specialist that you saw prior to surgery. Take your incentive spirometer home with you and continue to use for up to a week after surgery. To use the incentive spirometer, you will inhale slowly, Hold that for 3 seconds, then breathe out. Try to do that at least 10 times an hour. The chlorhexidine washcloths are always used for abdominal surgeries to reduce the risk of infections. They are a full body scrub. We do recommend the night before and surgical site the morning of surgery. Do not flush these wipes down the toilet. Please throw them away in the trash and let air dry for 2 minutes after application. Thank you.